Today, we're talking about the wonderful world of nursing to close out Nurses Month and celebrate the incredible individuals who play a vital role in healthcare. From the approach we as nurses take each day with our patients to sharing some of our stories from our own experiences, the Studio DOHC podcast starts right now. Podcast. I'm Jessica Voigt, and here with me is Ticman. Thanks for joining me today, Christine.
My pleasure. Thank you, Jess. Good morning.
No problem. You know what's crazy about today? We are recording today, and it's May 23rd. 15 years ago today, I graduated nursing school.
Wow, congratulations.
Yay. Isn't that exciting? I literally wore this hat right here on my nursing graduation day. I thought I'd bring it today.
15 years. That's an accomplishment, Jessica.
Thanks. Christine, tell me about your nursing journey.
Okay, let's see. So I have been in the nursing world now 18 years this summer. So July, I think, will be my anniversary date. I was an LVN for 13 years before I went back to school to get my RN degree. And it is the best decision I've ever made. I love being a nurse. So
that's excellent. It's amazing to me how we can all end up in the same, profession, but we all take different paths. And I think one thing for me that's really interesting about the nurse's role in healthcare is the diversity in which we can practice. I started out as an ER room nurse, and I started there, and I did 10 years in the ER before transitioning over to Desert Oasis Healthcare in a full-time management capacity. But working in the hospital, you really only see one side of healthcare.
That's correct. Absolutely.
And I think that was one of the biggest eye-openers to me when I came over to Desert Oasis as a nurse, is really kind of understanding this world of the outpatient world.
Absolutely.
What kind of experience or roles do you think or have you seen in healthcare?
I got the opportunity to start my LVN career as a skilled nursing facility nurse.
Oh.
And I do have to give my hats off to any nurse who has ever worked a skilled nursing facility. Yeah. Definitely hard work. But, like you, I did get the opportunity to go into the inpatient setting, med-surg background, a little bit of tele. I did acute rehab. And then I took a leadership role at a local hospital. And that was a huge eye-opener. I think one of the things that is so impactful with nursing is, like you said, we can literally go anywhere, and we never have the same day twice, right? So,
oh my goodness, so true. When I first graduated from high school, I was like, I'm going to go be a teacher. I really like to teach, and I started down that path. And then slowly but surely, I realized as a nurse, you can teach way more people.
Absolutely, yeah.
Like you literally can touch so many people, and just like you said, there's no 2 days are the same.
No, and nursing is so much about education. I mean, you see nurses now in administrative roles, educational roles. I mean, they're in the back end doing, computer medical records type
I know,
stuff.
Isn't that crazy?
I mean, you can literally go anywhere. And I mean, if we decided that, you wanted to get back into the floor, we can take a traveling gig and travel. I mean, nurses are embedded throughout the healthcare. And I think it's a good thing because we bring the heart of health into taking care of people, I think. So.
For me, also, one thing I didn't recognize with the nursing profession is during our training, we learned so much about the patient as a whole. And nurses really focus on the patient versus the disease process.
Absolutely.
Right? So we know the disease processes, the medications that can treat it, and kind of some of that. But I think nurses really wrap themselves around the patient as a whole. And we look at it from kind of a different perspective.
Absolutely. I think one of the experiences I had, having had like a case management background as well, is, the opportunity to sit with patients on a different level where when you're not doing a lot of that bedside and you're not on all these time crunches to get your tasks done, case management really brings a collaborative approach to patient care. And that's such a big deal now for nursing because it's not really just carrying out doctor's orders anymore. And so I love when you say that we bring this different level of compassion and empathy. And, I have a 15-year-old teenage boy who wants to be a nurse as well. He,
Oh,
like you, wants to go into ER trauma. So I just tell him all the time,
feel the thrill.
feel the thrill, and just getting to be able to take care of people every day. It's such a fulfilling job. Not many people can say that. So I think we're pretty lucky, right?
Oh my goodness, I can't tell you how lucky we are. Looking at nursing in our like everyday experiences, I'm sure you're like I am when I'm standing in the grocery store aisle and I'm like looking down at people's ankles and I'm like, oh, I really hope they're on the proper medications or have they seen a doctor lately? And I think that it's that ability that nurses have to then kind of even transition or make that approach to that patient or to see them, in their element. I think that we approach patients a little bit differently sometimes, and that wraparound approach of including a patient's family, of ensuring that we are really the kind of the leader of the ship, collaborating that approach, right? We're talking to pharmacists, we're talking to the physicians, we're speaking to the patients. And sometimes we're having those hard conversations, right? I know recently I've been involved in some end of life care for family members, as well as neighbors and friends. And I think that nurses really kind of um, wrap the family as well, and include them in the care and make sure that they're a part of it, because we can't really do it by ourselves, right?
Can't. It takes a whole team. And, we're so patient centered, like you said, in nursing. I mean, when you get to work as a nurse, like you said, oftentimes that falls to the nurse to be able to collaborate.
Mhm.
Did this specialist come in? What did physical
Mhm.
therapy say? What was social workers' recommendations? And you have to be able to connect the dots to all the key players of healthcare. And so I think we do a fantastic job at it, but it's not an easy job.
That's right.
And I think that nurses really want to care for people.
Absolutely.
And so, and our patients feel that. And
Yeah.
it's a great thing.
I think that like hub, I think I was calling it the captain of the ship a minute ago, but kind of like spokes coming off into each of those different specialties. Nurses kind of speak that language too, don't you think? Like you
Absolutely.
mentioned physical therapy. I think you learn to read through other people's notes, and then we translate that to a
Yeah.
certain extent to the patient, right? Like the patient will come looking at us like, what just was said? I don't even know what was said. And so, even being that like medical translator, I think is something I never thought of as a nurse.
No, yeah. We wear many, many hats.
Many hats,
Yeah.
much like this hat here. Well, nursing has become the number one profession. Again, I think we're on like, I honestly don't know the years, but I think somewhere we're like 18, 19, 20 years in a row or something like that.
Really?
That nurses have been the number one profession.
Interesting.
What do you think makes us the number one profession?
Many different reasons. I mean, if we're going to be fully transparent, financial stability is probably one of the number one reasons why people go into nursing.
Yeah.
But what I have to say, having been in this game now, both you and I, a long time, is that it really shouldn't be about, your financial endeavors or desires. I really, again, truly believe that if you don't have a passion for taking
Mhm.
care of people, you will not bring that compassion to the table. And sick people need that. Nobody asked to be sick. They don't want to be sick. I don't want to be sick.
Me either.
So, and that's probably why. Is so all of the elements that nursing can bring to the table, along with financial stability, a career that lasts a lifetime, the ability to, I think,
Mhm.
maybe go anywhere you want, travel, internationally recognized as a profession. I mean, so it's appealing. I was going to say appetizing because I'm hungry.
Me too. Me too. Thank
But
goodness I have my coffee
I meant
this morning.
appealing. Appealing is the word I was looking for.
I think you're right. It is an appealing feeling. Feeling? No, an appealing profession. Appealing feeling. Now you got me tripping.
Sorry, we're both hungry.
Well, I think one of the best parts about nursing is just the variety of patients we get to see. I mean, I can't tell you how many times I've been recognized for, fun care, great care, kind of some silly things sometimes. I'll tell you, when I was in the ER, I had this car of Marines that unfortunately was in a car accident.
Oh.
I know, but the good news is they were all not hurt to an extreme. And it was really funny. one of the Marines would look up as I was the trauma nurse, and he would look up over me and he would be like, "I'm gonna marry you one day."
Oh.
And he said, "I promise you, I will come back and I will ask you out on a date." And I told him, "I'm sorry, I'm married. We can't do that."
Yeah.
But I will tell you, 6 months later, he showed back up at the ER with a dozen roses and a sweatshirt that said U.S. Marine Corps. When I showed up wearing it that night, my husband was like, "What is this?" But these are kind of those moments. These are those little pieces of recognition that I think kind of push us a little bit, that
Absolutely.
make us want to provide the best care and recognize that while this was like a really traumatizing event for him, he also added some light to it and then came back with that recognition. And it's something I carry forever. In fact, I still have the sweatshirt.
Oh, well, you left a lasting impression, so he
True.
did too. And that's a great thing. I think one of the experiences I had that I take with me forever is, we had a patient in the hospital who was actively dying on comfort measures.
Mm.
And it's a very difficult thing to see when you know that somebody is experiencing end of life. And this poor patient was holding on,
Oh.
and she had many visitors and lots of people came to say their goodbyes. But she had an estranged daughter who didn't, they made every effort to call her and let her know. But the daughter never reached out and never came to visit. And so I remember specifically, holding this patient's hand and saying to this person, sometimes people wait and, there's no reason to wait and,
Yeah.
and rest easy now. And I saw her take her last breath after I held her hand.
Mm.
So, I want to contribute that to, I'm not her daughter and I'm not there
Sure.
to replace her daughter, but obviously I
Absolutely.
didn't want her to pass alone. And if that's what she was afraid of,
Mhm.
then she didn't do it alone. So I take that with me and I
Yeah.
feel like it's a good feeling to be able to be there for somebody, even through their
Absolutely.
death. So we are able to do that in our
Mhm.
field, and it's a beautiful thing.
Yeah. I think it's incredible that nurses truly see patients from birth to the end, right? And you just gave us such a great and like just a lovely role that you were able to play in that patient's life.
Yeah.
And I think that we all have met those nurses, the ones that go that extra step, who really want to be there and show that compassion and have that purpose, right? Your
Abs-
purpose that day was to be there with that patient.
right, right.
Oh, you get me all emotional about
Oh,
this,
sorry.
Christine.
Well, I just
No.
wanted to share that. And I think that, working for Desert Oasis Healthcare, we're so lucky and fortunate to be working alongside so
Mhm.
many great nurses who really
Yeah.
share the same compassion and who really
Yeah.
want to make a difference. And it
Mhm.
inspires us, I think, as leaders in the organization to want to do better and to find, you know, that little thing that makes a
Mhm.
difference. When you get to touch lives in a positive way
Yeah.
like that, it makes all the world of a difference. So even if there's a few days of
Mhm.
bad or difficult, I guess is a better word, challenging,
Yeah.
all the good deeds we do in between make it all worth it.
They really do. They absolutely do. I think that, we really here at Desert Oasis put an emphasis on helping people live well.
Yes.
You know what I mean? Like, we
Yeah.
want you to live well. We want you to be your best self, your best life. And nurses really, I think we believe that to our core,
We do.
right? I mean,
I mean, we oath in to do that. So
that's right. That is right. Remember that on my graduation day.
on your
I took
graduation
that
day, you
oath.
took this
I
oath. So
did. I did. And I think that that's an important thing to remember too, is that, we really want people to live well. We want people's wishes to be what they want. And we respect that about
mhm.
patients. We truly do. And we respect where they're at. One thing I think has been so amazing with Desert Oasis is that we get to meet patients where they're at. Like, think about our mobile unit.
Right.
And nurses, we have nurses on our mobile unit who go out to the community and give vaccines, help with, like physicals and support the doctors. They're there to help ask medical questions. And really, that transition of kind of like a community nursing and that public health is
Yeah.
such an interesting thing that we do as well here at Desert Oasis.
I mean, Desert Oasis does so much. And, hats off to all the nurses, too, who are going into homes,
Oh,
environments that
goodness,
they might not be
for
aware of.
sure.
They take the risk every day
Every day.
to, take care of patients. And to be part of Desert Oasis Healthcare, where again, we're meeting them at their level, and what makes it easier for their life, and letting them know that we're here and happy to connect with them as long as they allow us to. There's not, to me, there's not a lot of organizations who wholeheartedly want to do that for the members of our community. And so proud to be part of a team, again, of nurses who stand for our job role and really take our oath and take it seriously.
Sure.
So
I know. I always call it creative nursing.
Yeah.
I really think we're creative. This is creative nursing. Well, Christine, I really appreciate you joining me today. And we really appreciate all of you listening in on this wonderful podcast. We hope we've shared some insight into the wonderful world of nursing. Please like, share, and subscribe to our YouTube channel for future episodes. We will be discussing things healthcare. And so for more information on what Desert Oasis does, visit our website at mydohc.com.